So thank you to the organizers for the opportunity to discuss our experiences with the SPIRIT initiative, which aims to improve the reporting of protocols for clinical trials. Now, whenever I talk about promoting transparency and quality to audiences not involved in clinical research, for example, with preclinical research, we often get the reaction that, well, it's easy for you guys do clinical trials, heavily regulated, clearly defined research. It's much harder in non-clinical research or non-trials. And so, but I do hope that you'll see that there are still ample challenges within clinical trials in the area of improving transparency and quality, and that some of the lessons can be learned and applied to preclinical research. Just to give you an idea of where I'm coming from in terms of my perspective, so as mentioned, I chair the SPIRIT initiative and the Scepter tool. I also joined as the co-chair of the Consort Initiative and currently chair the WHO's advisory panel for the Clinical Trials Registry platform. So what is the current landscape of trial protocols? And this talk will mainly focus on how improving protocols can really drive quality and efficiencies downstream. So our group and others have reviewed thousands of protocols to evaluate their completeness of content. And consistently, we find that clinical trial protocols often do not address key methodological elements. You can see, for example, a quarter of them don't define a primary outcome, which is quite shocking in this day and age. So we launched the SPIRIT initiative and published our outputs in 2013 to help improve the quality of content of trial protocols. So our outputs consist of a checklist of key information that should be addressed in a trial protocol, as well as a lengthy explanatory document that goes through the rationale for why each item is important to address. We've been fortunate to have had widespread adoption as a standard for trial protocols, with endorsement from over 120 medical journals, by national ethics regulators, such as in the UK, the Health Research Authority requires that trials adhere to SPIRIT for their submitted protocols. Funders, national funders, have based their templates on the SPIRIT guidance, as well as some pharmaceutical companies have adopted SPIRIT as the standard for their protocols. SPIRIT has been translated by WHO and other groups into 6 languages. We know of at least 600 protocols that have been published based on SPIRIT. Of course, we know that the vast majority of protocols are unpublished, so there's no way to track those. And our website is currently used by about 50,000 unique users annually. But the adoption of SPIRIT is clearly not universal, and we continue to focus our efforts on trying to improve implementation. So the first key area to address are incentives, and we've heard quite a bit of discussion about this already, and the incentives for improving the reporting of trials is no different than other types of research. We know that although we would hope that a desire for high-quality research and for improved transparency would help motivate researchers, that we are all busy and that often is perceived as additional administrative burden. So one key component that we have been promoting is how can use of SPIRIT and other guidelines actually improve efficiency and save time and change that perception in terms of efficiencies downstream. So for example, we all complain about how long it takes to receive IRB or ethics approval for research. I serve as the vice chair of our IRB, and we see this all the time. But there is empirical data that a lot of the delays are due to inadequate content of documents that are actually submitted in the first place. So this study that reviewed almost 300 industry trial protocols found that the vast majority were sent back for revision, as we all know, but that half of the revisions related directly to inadequate content in the original submitted protocols. And so if we can improve that from the beginning, then the time to IRB approval could be shortened. And this should be viewed as an advantage or a benefit to investigators adhering to the SPIRIT guidance. Even after ethics approval is received, most trial protocols undergo formal amendments, on an average of 3 amendments per trial in this study. And the sponsors classified a third of those amendments as having been potentially avoidable, had greater attention been paid up front at the protocol stage. And they quantified each of these amendments as leading to over 2 months of delays while the trials put on hold to implement each amendment, as well as 4 weeks of delay in the registration of their trials on a public registry. And they quantify this in dollar amounts as well as costing overall the industry over $2 billion annually in terms of these time delays. So there are clear downstream efficiencies that can be gained from adhering to reporting guidelines up front to ensure that the protocol document itself is complete and of high quality. Now, it's important, of course, we've heard to not only have rewards or incentives, but also to have enforcement. And you can see here the various stakeholders that have the authority to implement and enforce policy. So journals play a key role. We've seen this with the advent of trial registration, which had been first called for back in the 1980s. But the desire for transparency and quality was insufficient to motivate researchers to register their trials until journal editors really issued their statement in 2005. And so there's clearly a role for journal editors to adopt policies requiring adherence to, for example, reporting guidelines or transparency initiatives, recognizing that this, as we've heard, it just does not come without a cost. As peer reviewers, it takes a lot of time to check a manuscript. I mean, I do it because I obviously have an interest, but I'm a senior editor with the Journal of Trials, the largest publisher of protocols, and their policy of requiring that every protocol submit a spirit checklist and where in their protocol each item is addressed has really pushed implementation of spirit. But even so, when we get a protocol, often the manual checking takes a great deal amount of time, and the checklist tick mark doesn't necessarily match what is actually in the protocol. So we can't underestimate the amount of time to implement these policies and to actually enforce them. It's not enough just to have a statement saying that they must adhere. The enforcement takes a great deal of investment of resources. The similar experience has been seen with Consort, where half of PubMed index journals require adherence to Consort, but still the trial reports that are published, the vast majority still do not fully adhere. Funders with the dollars obviously have key enforcement power. One example is the National Institutes of Health Research in the UK that has an outstanding 96% publication rate for all of their funded research, which is much higher than the average of 50% that we see across all types of funding agencies. And they achieve this by withholding some of the grant funds until a final report is actually published. Regulators, through legislation, can also improve quality initiatives and transparency initiatives such as registration, although this is only focused on drugs and devices that are regulated. And then institutional review boards can promote adherence as well. So at our hospital, investigator-initiated clinical trial protocols are required to adhere to the spirit guidance. And the third aspect is building capacity. So we really want to provide the tools for researchers to adhere. And so the explanatory paper accompanying the spirit checklist provides model examples of good reporting from actual protocols, addresses the rationale for each item and why it's important to address, and provides references to further reading. It's important in this day and age of technology that we also provide software that makes it easier for researchers and saves them time to adhere to guidelines like spirit. And so we've developed a software tool called Scepter, which aims to help investigators author their protocols more efficiently while adhering to the spirit guidance, and also to save time with other added value features. So I'll just briefly take you through a quick demo. So this users log in and have their protocols on their dashboard, which they select, and this loads the working interface. And you can see on the left-hand side is all of the Spirit checklist items that should be addressed in a protocol. And if you click on one, some of the fields are drop-down menus, some are more free text. In this case, the drop-down menus to identify which registry you're registering in. If a user is not sure what this item means, they can click the information button, which takes them to the Spirit website and the explanation and the model examples for that particular item. Some of the fields are more free text-based, and once they're all completed, then this generates a formatted Word document or PDF that reflects all of the entered information that should be adherent to the Spirit guidance. Now, we wanted to add features that would help investigators save time, so we did find it's not enough just to publish our guidance and expect everyone to use it. Researchers want to see something that doesn't add additional burden or time, if at all possible. And so they can register their trial with the click of a button on clinicaltrials.gov. And so this reduces the registration time from hours to minutes. They can also track amendments automatically by highlighting the amended text. And then that gets pulled into a window and is displayed in a table of amendments for the next protocol version. So just to conclude, our aim really with the Spirit initiative is to promote high quality content of trial protocols while also providing tools that will help investigators to save time while also adhering to Spirit. And our key areas of focus for promoting implementation really involve evaluating the incentives, the enforcement mechanisms, and tools to build capacity so that this can become more widespread and universal. And we're not there yet, but I think things are moving in the right direction, and hopefully for the preclinical research field, some of the lessons can be drawn from our experiences. Thank you.